Theory and Practice of Counseling and Psychotherapy, 10th edition. Chapter 12, Feminist Therapy. Introduction. Feminist counseling is essential to consider the social, cultural, and political context that contributes to a person's problems in order to understand that person. Feminist psychotherapy is a philosophical orientation that lends itself to an integration of feminist, multicultural, and social justice. Feminist perspective offers a unique approach to understanding the roles that women and men with diverse social identities and experiences. History and development. No single individual can be identified as the founder of this approach, reflecting a central theme of feminist collaboration. The beginnings of feminism, the first wave, can be traced to the late 1800s. The women's movement of the 1960s, the second wave, laid the foundation for the development of feminist therapy. Constructs of feminist theory. Gender-fair approach explains differences in the behavior of men and women. Flexible, multicultural perspective can apply equally to individuals and groups. The interactionist view is specific to the thinking, feeling, and behaving dimensions. A lifespan perspective assumes that human development is a lifelong process. Feminist perspective on personality development. Societal gender role expectations profoundly influence a person's identity from or even before birth. Gilgan, 1977, recognized that the development of women was judged by male norms. Females are raised in a culture grounded in sexism, and understanding internalized oppression is central to this approach. Relational-Cultural Theory. RCT emphasizes the vital role that relationships and connectedness with others play in the lives of women. Therapists adopting this approach aim to reduce the suffering caused by disconnection and isolation, increase clients' capacity for relational resilience, develop mutual empathy and mutual empowerment, foster social justice. Principles of feminist therapy. The personal is political and critical consciousness are central concepts. Those who practice FT are committed to social change. Women's and girls' voices and ways of knowing and the voices of others who have been oppressed are valued. The counseling relationship is egalitarian. FT focuses on strengths and a reformulated definition of psychological distress. All types of oppression are recognized along with the connections among them. Therapeutic goals. Feminist therapists help clients become aware of their own gender role socialization, identify their internalized messages of oppression, and replace them with more self-enhancing beliefs. Understand how sexist and oppressive societal beliefs and practices influence them in negative ways. Acquire skills to bring about change in the environment. Develop a wide range of behaviors that are freely chosen. Restructure institutions to rid them of discriminatory practices. Evaluate the impact of social factors on their lives. Develop a sense of personal and social power. Recognize the power of relationships and connectedness. Trust their own experience and their intuition. Role of assessment and diagnosis. Diagnoses are based on the dominant culture's view of normalcy and cannot account for cultural differences. Feminist therapists have been sharply critical of the DSM classification system, including the current DSM-5 edition. Critique is based on research indicating that gender, culture, and race may influence assessment of clients' symptoms. Techniques and strategies. Empowerment, self-disclosure, gender role or social identity analysis, gender role intervention, power analysis, bibliotherapy, assertiveness training, reframing and relabeling, social action, group work. The role of men in FT. Male feminist therapists are willing to understand and own their male privilege, confront sexist behavior in themselves and others, redefine masculinity and femininity, work toward establishing egalitarian relationships, engage in and support women's efforts to create a just society. Application to group work. Group provides an outlet for social support and political action, forms a diverse community where members share the goal of supporting women's experiences. Group setting decreases feelings of isolation and loneliness. Application to group work. Self-disclosure is emphasized for both the leader and members as a means of self-exploration. Provides a setting where clients learn to use power appropriately by providing support for each other and taking social, political actions. Strengths from a diversity perspective. FT has the most in common with the multicultural and social justice perspectives. Clinicians strive to create an egalitarian relationship and collaborate in setting goals and choosing strategies. Feminist therapists believe psychotherapy is inextricably bound to culture. Limitations from a diversity perspective. Advocating for change in the social structure can be problematic when working with women who do not share these beliefs. If therapists do not fully understand and respect the cultural values of clients from diverse groups, they run the risk of imposing their own values. Contributions of feminist therapy in multicultural and social justice perspectives has paved the way for gender-sensitive practice and an awareness of the impact of the cultural context and multiple oppressions. Has emphasis on social change which can lead to a transformation in society, has made significant theoretical and professional advances in counseling practice, called attention to child abuse, incest, rape, sexual harassment, and domestic violence, demanded action in cases of sexual misconduct at a time when male therapists misuse the trust placed in them by their female clients. Principles and techniques of FT can incorporate into many therapy models. Limitations and criticisms of feminist counseling. Identify any sources of biases and work toward restructuring in any theories they employ. Influence clients, especially those who lack a strong sense of their own values. Call attention clients' unexamined choices, and they must honor clients' choices as long as those choices are indeed informed. The heavy contextual or environmental factors that may detract from exploring an intrapsychic domain. Client can understand external realities that are indeed oppressive and contributing to the state of depression. Training in FT is often offered only sporadically in a non-systematic way, and there is a lack of quality control.